Okay, well, welcome everyone, and to those of you that are online. I'm Cindy Huber, and I'm the CEO of the National Kidney Foundation of Wisconsin. We want to welcome those of you that are in the room here. We have a robust group here, and they look pretty fun. So we'll see by their questions how fun they are. And for those of you that have joined us online or via Facebook, welcome. These are programs that we do on a monthly basis, and so we're glad you're able to join us. Our topics do vary each month, and tonight's topic by at least the audience that's here, this is of interest, I think, to a variety of people, because especially in 2020, as I think we all are thinking more about civic engagement, voting, and what's happening as it relates to public policy. And tonight we're going to hear from one of our great volunteers about who is a part of our advocacy committee and is going to share some information that I think affects many thousands of people in our state and throughout the country. Next slide, Jen. There we go. All right. All right, Sarah, we found you. And hopefully you can hear us okay. For those of you that are online, if you're able to type your questions, we have someone here that will watch for your questions, and then we'll say those out loud. So both Sarah and the folks here in the room can hear the questions. For those of you in the room, when you ask a question, you can follow my lead and use your playground voice if you're able to. Otherwise, we'll repeat your question so folks that are online can hear. We are recording this session and the PowerPoint that you'll see, because there'll be many more slides available. So you'll always have access to that on our website, or we'd be happy if you don't have a computer and would like us to print it out for you and mail it to you. We're happy to do that. For those of you that are here in the room, if we don't have your email address, if we could also have that, that's helpful for any program updates. And I'll just say that any immediate updates will always be on our Facebook page. So as things move quickly, whether it's about legislation or other things that are of key interest in the transplant area, organ donation, living donation area, we'll always put it there also. So if you're not getting emails from us, and if you do use Facebook, it would be great if you do follow us for that. So Sarah, have you, they already took you away, but Sarah is joining us, and I don't want to steal too much of her thunder, but I will say that in Sarah's heart is filled with gratitude, and gratitude to give back and make a difference for people. And I've had the pleasure of working with Sarah as a volunteer, especially in the advocacy area, for well over a year, I believe. Is that correct, Sarah?
Yes.
And so I'm going to turn it over to you. I want, maybe you could let everyone know where you are, and I'm going to turn it over to you, and thank you for joining us tonight.
Thanks. I do have a request, John. I'm seeing a view of the slideshow that includes the notes version. Can you turn that off and make it a full screen slideshow? While you're working on that, I want to thank you, Cindy. It is my pleasure to share my passion for advocacy with tonight's audience. In terms of an introduction, I'll share that I have worked on the fringes of the healthcare field for the past 30 years. Initially, I worked for home medical equipment companies and billed insurance companies for our patients. Currently, I'm on the other side of that equation, and I work for an insurance company as a durable medical equipment specialist and program coordinator. I'll share a little bit more about my kidney disease throughout the presentation, and want to let you know that I live just outside of La Crosse in what is arguably the most beautiful part of the state with my two cats, Marlin and Bubba, and I'm hoping that you will not hear them in the background tonight. Before I begin, I do want to share that when I have work presentations that are done through PowerPoint, I find it very frustrating when somebody just reads from the PowerPoint slides. So I'm not going to be doing that this evening. I don't think that's an effective way of delivering a message. So during this presentation, I'm going to encourage you to read the slides to yourselves, and I'll talk about the meaning or message behind the information. Hopefully that works for you. And of course, there will be time for question and answers in case there's anything on the slides that you do have questions about. While what I'm saying tonight will seem like it's all about kidneys, remember that living donors can also donate a part of their liver. If anything applies specifically just to kidney donation, I'll let you know. And if you could move to the next slide. So we decided that tonight our program would be about New Year's resolutions. And the beginning of a new year is an opportunity for a fresh start. Many people choose to make New Year's resolutions. One study that I found shows that only about 9% of people who make resolutions feel that they successfully achieve them. But the Journal of Clinical Psychology states that people who make resolutions are 10 times more likely to actually change behavior. So just the act of making a resolution makes you more likely to change your behavior. Most people resolve to lose weight or spend less money, get in shape, or other somewhat ambiguous goals. We're already halfway through January, and I'm curious if any of you made resolutions. Are you still trying to make those changes, or have you given up? Tonight, I want to work on resolutions that we can all keep in 2020. In a few minutes, we'll revisit these ideas shown on this slide, and we'll have more specific ideas about how to become an advocate for transplantation in 2020. Hopefully, this will inspire you to either begin advocating on behalf of kidney and liver patients facing transplant, or become a more effective advocate if you're already involved in this important work. Could you go to the next slide, please? So allow me to share my path to becoming a political advocate. It was a bit of an unusual journey. You know the expression that ends with some people having greatness thrust upon them? Well, I kind of had political advocacy thrust upon me. I first learned about political advocacy working for a home medical equipment company around the year 2008 when the Affordable Care Act was first being discussed. The company I worked for was part of a statewide association of home medical equipment companies, and both my boss and I were active on the board of that association. One very small part of the Affordable Care Act introduced something called competitive bid for home medical equipment, which our industry thought was a very bad idea. For 6 years, I worked on behalf of the association by going to Washington, D.C., and trying to first remove this passage from the ACA and then to change it once the ACA passed in 2010. Advocacy wasn't really my choice since I was selected by the association for the role, but I was very passionate about what competitive bid could potentially do to our customers and our companies. So I was happy to take on that role. My first trip to Washington, D.C. was quite interesting. Because the association decided to send me to a national conference at the last minute, my flight was booked within a week of the travel date. In that post-9/11 world, I was flagged for a full-body TSA check at every stop I made. But thankfully, the TSA staff in Milwaukee explained that it was because of the last-minute booking to our nation's capital. The organization that was putting on the conference didn't have time to make any of my legislative appointments, so I spent that week before the conference frantically calling the offices of both senators and all 8 representatives to try to get appointments. Honestly, I probably did a better job on my own than that conference organizers would have done. I didn't know the layout of Capitol Hill. I had never been to Washington, D.C. before, so I didn't know that the buildings that house our legislators' offices are on both sides of the Capitol, which means they are 5 very long blocks apart. Of course, I was running back and forth for 2 days because I would have one appointment on one side of the Capitol and then the next appointment on the other side and so on. My fashion choices were also not good. I was wearing skirted business suits with pantyhose and high heels, and it was very hot and humid. On the afternoon of that first day, I had stripped off those pantyhose and stuffed them in my purse. Visits during subsequent years were all about pants and flat shoes. And if you ever go to Washington, I highly recommend flats. At that first conference and the subsequent ones, I learned a lot about how our government works and the importance of effective grassroots lobbying for bills that we are passionate about, whether we're representing a company or our own personal interests. I became interested in using those skills on behalf of kidney patients in 2017. My family is affected by polycystic kidney disease, and 2 of my siblings and I are kidney transplant recipients. We were all extremely fortunate and received our transplants before needing dialysis. However, our paths to finding kidney donors were very different, and it's those different paths that inspired me to find ways to advocate on behalf of people needing transplants and those who donate to those transplant recipients. My sister received her kidney from a deceased donor, and that inspired her to begin volunteering for UW Health organ and tissue donation shortly after her transplant. Nearly 10 years later, she's now a paid employee, and she inspired me to begin volunteering in 2017. Volunteers for UW organ tissue donation speak to driver's education classes about signing up as donors when they get their licenses, and staff educational booths at events to promote registering as organ, tissue, and eye donors. I've volunteered at a number of different types of events, including marathon and 5K races, fishing expos, fundraisers put on by donor families, and other types of events. Then, approximately 3 years ago, my brother received his kidney from a living donor. His wife donated on his behalf, and she had difficulties with her employer, who insisted that she return to work in 2 weeks or face losing her job. Currently, it's legal for a company to enforce this type of requirement. Then I was accepted into the transplant program in 2017. I tried to find a living donor, and while several friends agreed to be tested, some were denied for health reasons, but more were unable to donate because they learned they could be off work for potentially 6 weeks for recovery and couldn't afford to go without income for that period. In many cases, FMLA, the Family Medical Leave Act, doesn't cover living donors because living donation is an elective surgery and it is not for the donor's serious health condition. So unless the donor and the recipient are immediate family members, the donor would not qualify for FMLA. I ended up receiving a kidney because a woman who was planning on a non-directed donation heard my story and decided to donate on my behalf. And it was at that point that I began looking for ways to become an advocate. I was accepted by the National Kidney Foundation as a member of the Kidney Advocacy Committee just after my transplant in August of 2018 and connected with Cindy at NKFW Wisconsin shortly after. I've been primarily focused on getting support for a bill called the Living Donor Protection Act, and now we have new proposed legislation that is very exciting, and I'll talk about both of these bills in just a few minutes. Could you go to the next slide, please? Some of you may recognize this picture. Schoolhouse Rock had it absolutely correct for those of you that remember those little short videos that were shown between Saturday morning cartoons. If you haven't seen it, look for Schoolhouse Rock bill on YouTube or Google it. It's very entertaining, and I have remembered it ever since I was a child when I first saw it on television. This slide shows you the basics of how a bill becomes a law, and I'll show a little more detail about what happens when the bill is in committee on the next slide. It's important to have a basic understanding of this process, especially if you want to enlist friends and family to help with your advocacy efforts. knowing where the bill is in the process is important. There are 3 branches of government, and it's the legislative branch that's the one that writes, submits, reviews bills, and determines whether they will be approved and forwarded to the president, part of the executive branch, for signing into law. The legislative branch, also called Congress, consists of 2 chambers or houses, the Senate and the House of Representatives. The Senate has 100 members, 2 from each state, and the number of members in the House of Representatives is determined by population. That number is currently capped at 435, but after each census, the number of districts in each state can be changed. The total number of representatives will stay at 435, but each state could potentially lose or gain a district and therefore a representative. Prior to 2003, Wisconsin had 9 districts, but declining population reduced the number to 8 because adjustments were made after the 2000 census, and those adjustments went into effect in 2003. So at that point, we lost a district and a representative, but some other state gained a district and a representative. So can you go to the next slide, please? It's another picture from Schoolhouse Rock's I'm Just a Bill. The bill can be assigned to one committee or to several committees within each chamber of Congress. Once it's assigned to a committee, it's often then assigned to a subcommittee that focuses more specifically on the topic. When Medicare is involved, as it often is when it comes to transplantation, there are several committees in each chamber that will review the bill. In the House of Representatives, this would include, at the least, the Energy and Commerce Committee and the Ways and Means Committee. In the Senate, bills related to Medicare and transplantation would be assigned to the Committee on Health, Education, Labor, and Pensions, and or to the Finance Committee. When advocating, it's important to know what committees your senators and representatives are on, because if they're on one of the committees reviewing the bill, their co-sponsorship is even more important. And committee members can ask for hearings on bills that either have a lot of support or are fast-tracked. According to an article I found from 2013, only about 5% of the bills that are introduced become law. And can you go to the next slide, please? So this is a map of the districts in Wisconsin. Take a moment to find your district. For most of Milwaukee, I'm assuming that since most of you are in the room, you're in that area. You're probably in District 4 if you're in Milwaukee proper. The southern suburbs of Milwaukee are District 1. The western and northern suburbs of Milwaukee are District 5. Madison and that surrounding area is District 2. And because I'm in La Crosse, I'm in District 3. And on the next slide, we'll show who the representatives are from those districts and their committee assignments. So you can see on this slide that District 7 is vacant. Sean Duffy was the representative from that district, but he retired this past fall because there's a serious health condition in his immediate family. Primaries are scheduled to fill this seat for February 18th, and then the general election to fill the seat will be in May. And predictions are that this state will remain under Republican control. In the House, remember that Ways and Means and Energy and Commerce usually handle Medicare legislation. In the Senate, the bills usually go to the Committee on Health, Education, Labor, and Pensions. So 3 very important people on this slide are Gwen Moore from District 4, Ron Kind in my district number 3, and our Senator Tammy Baldwin. The subcommittees that the legislators are assigned to are also important. For example, while Gwen Moore is on the Ways and Means Committee, the subcommittee that she's assigned to doesn't usually review the types of bills we're discussing. But if and when that bill goes to the full committee for approval, her support will still be important. So Ron Kind has he's usually on the subcommittee that reviews the bills, and then is also obviously on the full committee, and then Gwen Moore would only be on the full committee. And then Tammy Baldwin, of course, is on Health, Education, Labor, and Pensions. Can you go to the next slide, please? So what is your role in this process? If you're willing to take the time to contact your legislators, your voice really does matter. Generally, you would have 3 legislators to contact if you're passionate about a bill, both of your senators and the representative for your district. It generally doesn't help to contact legislators in other districts because you aren't their constituent. When you contact any of these legislators, you'll provide your name and full address. And if you don't live within their district, you know, unfortunately, your voice doesn't matter to those people. But when you are in the district, it really does have an impact. The staffers that work for our legislators, both in local offices and in Washington, keep track of the phone mails, letters, and emails that they receive about various issues. The more they hear from constituents about a particular bill, whether for or against, the more attention that that bill will receive. The staffers notify their boss when they get a lot of buzz about a particular issue and whether the constituents want the legislator to support or not support the bill. So if they get 100 calls in favor of a bill and 10 calls against the bill, they're going to report that to the legislator that it seems like the majority of the constituents are in favor. Those legislators can choose to co-sponsor a bill, which generally means the bill is introduced by a couple of sponsors and then other people can sign on over time as co-sponsors to show that they support the bill. Co-sponsoring the bill doesn't mean that they're committing to vote for it should it come to a vote, but it does show support. When contacting your legislators, the one type of communication that is the least effective is snail mail. And it's not very effective because it takes quite a long time to actually get there. You may remember that anthrax was used in letters mailed to news outlets and to politicians back in 2001. And ever since then, mail goes through a process where it's scanned and irradiated and all kinds of other things happen to it to make sure that there aren't any weapons of mass destruction in those letters. So the more effective ways are to use phone calls and emails, and for those of you that are savvy with social media, Twitter and Instagram can be particularly effective. Many of our legislators actually monitor their own social media accounts. They don't necessarily have a staffer doing that for them. So if they're monitoring their own accounts, they know how many times they're tagged and when things are directly sent to them. There is some very helpful information about using social media on the National Kidney Foundation's website, which is kidney.org, and there's a section on that website specifically for advocacy. I recommend that you look for those documents, and Cindy, maybe we can get those documents posted on kidneywi.org on the Kidney Foundation of Wisconsin website. The more, when you're contacting your legislators, the more you can tell a personal story and how the bill will affect you, the more impact your message will have. At the Capital City 5K in Madison, we had postcards about the Living Donor Protection Act available for participants to complete, and those postcards were subsequently presented to their senators or representatives. Participants wrote meaningful and sometimes heartbreaking stories about how important this legislation is to them. Volunteering at these types of events is one type of advocacy. Something else that I've done recently is reach out to service organizations, and just a few weeks ago I spoke to the Rotary Club of Holmen, Wisconsin, about kidney disease and organ donation. Can you go to the next slide? So we had that slide a little bit earlier that talked about how to make resolutions effective, and this takes those same ideas and gives you some specific ideas about how to make these goals work for you. We'd really like everybody to start advocating or become a more effective advocate in 2020. You certainly don't have to do all of the things listed, and you can obviously advocate in other ways. If you're at an event like the Derby Dash in Milwaukee or the Capital City 5K in Madison, talk to the NKF volunteers that will hopefully be at the advocacy table to see what current issues are and how you can help. I use a website that's called GovTrack, GovTrack.us, to track the bills that I'm interested in. And I can sign up for daily or weekly updates on those bills. So any action that's taken on them, I get an email and I know what's going on. Another thing to do is go to National Kidney Foundation's website again, kidney.org/advocacy/resources, and that's where those tools are, including suggestions for tweets and Facebook posts. I mean, they actually write out the post for you. You just copy and paste it to your own Facebook tweet. When you're at kidney-related events, post pictures on social media and tag your legislators. Use clever signs and hashtags. NKF would like you to use hashtag #MyKidneysMyLife when you're doing anything and contacting legislators, so they'll see it as well. If you do have an event like a walk or something that's related to kidney transplantation or liver transplantation or anything related to kidneys and livers, see if the event organizers can invite your legislators when events take place in your district. I'll talk in a little bit about who introduced one of these bills. If they've already co-sponsored, you can thank them by any of those contact methods, but tagging them on social media is really going to get them the most attention. Make contacts frequently. If you're willing, call your legislator's district office to have a face-to-face meeting. You may not always meet with the legislator themselves, but establishing a relationship with their staff is just as important. Because I do this on a regular basis, I even had business cards made up showing I'm a volunteer with NKF, and I let them know that they can use me as a resource if they have a constituent who has questions about anything related to kidneys, whether it's trouble finding a transplant center or anything, and they can use me as a resource if they need to. I will tell you that they've never called me. We can also work with state legislators to try to get a state version of one of the bills I'm going to talk about, the Living Donor Protection Act, passed. Alberta Darling is a state senator, a Republican state senator in River Hills, and she has a direct connection to transplantation issues. Her husband unfortunately passed away waiting for a kidney and pancreas transplant. She proposed legislation similar to the Living Donor Protection Act in 2016, but it didn't pass, and I'm fairly certain she would be willing to do that again. If you know of other state legislators that may have an interest in working on a state version of the Living Donor Protection Act, let Cindy know. We're in a difficult environment right now getting any laws passed at the state level and at the federal level, but we have to start somewhere. Another idea is to ask your employer if they have a policy for employees that want to be living donors to cover them while they have time off, something similar to the Family Medical Leave Act, but specific to living donation. We know of several employers that do have these policies, and we may be able to help provide sample language if your employer wants to implement a policy and needs some help. Policies like this may not be paid leave, paid time off, but at least the employee would know that their position is protected. And in some cases, employers allow employees to donate paid time off to other employees when they're in need. Can you go to the next slide, please? Thank you. So this is one of the bills that I'm just very excited about. This is a bill that was recently introduced, and it really appears to be on a fast track to get passed. Just in this time frame, the President does seem to have an interest in bills that are related to kidney health, and he's worked with the National Kidney Foundation and other organizations to get some other things, other executive orders related to kidney issues. He's already gotten those signed. So if this legislation were to go to him, he would likely sign it into law. This bill was introduced by Ron Kind. Yes, he's the representative from my district, but I can't take any credit for this. He was one of the sponsors to initiate the bill, and there were some others. And it was first introduced on December 29th, so just weeks ago. It has bipartisan support, and there has already been a hearing held on Thursday, January 8th, in the Subcommittee on Health, which is part of the Energy and Commerce Committee in the House. At that hearing, one of the speakers was Dr. Matthew Cooper. He's a transplant surgeon in Washington, D.C., and he's on the board of the National Kidney Foundation. And I want to share some of the things that he had in his testimony. This is my I forget what the word is that I wanted to use. I'm not quoting directly from what he said. I'm just summarizing some of his comments. So one of the things he said that kind of shocked me is that 80% of kidney transplant recipients are under age 65. And I know I am, but I was just surprised that 80% of the transplant recipients are under age 65. He also talked about a 2013 New England Journal of Medicine article that reported that 70% of the cases where patients are unable to pay for anti-rejection medications result in either death or organ rejection. The average cost for dialysis and transplant were compared, and this is also shocking. Dialysis costs Medicare nearly $86,000 per year per patient. And compare that to immunosuppressive drugs, Medicare pays only $2,600 per year. Now, that figure, this is me talking, not Dr. Cooper, that figure may be artificially low because Medicare is often secondary to other insurance coverage, so that doesn't necessarily reflect when they're paying the entire bill for the immunosuppressive drugs. But again, dialysis, $86,000 a year, and Medicare pays currently only about $2,600 per year for the immunosuppressive drugs. Even after paying, I'm back to Dr. Cooper, even after paying the $110,000 for the transplant itself, the cost savings to the Medicare program are clear when they cover the immunosuppressive drugs. Dr. Cooper also said that he found it frustrating as a taxpayer that Medicare will pay for dialysis or a new transplant after a transplant fails for lack of coverage of the medication. So in other words, if coverage only lasts for 36 months now and a patient can't afford their medications and chooses to stop taking them at the end of that 36-month period, Medicare will jump back in, pay another $110,000 for another transplant, or that $86,000 per year for ongoing dialysis. And that just doesn't make any sense. So I'm told that throughout the hearing, members of Congress commented on the absurdity of the current policy and promised to move the bill quickly. Subcommittee chair and co-sponsor of the legislation, Anna Eshoo, who's a Democrat from California, commented, quote, "This bill will move. It just makes sense," end quote. Clearly, this is very promising, but the National Kidney Foundation and kidney advocates must continue to advocate for passage of this life-saving legislation. Now, this legislation only provides coverage if the kidney recipient doesn't have other coverage available, so it won't affect everyone. But I understand it also allows for re-enrollment in Medicare if employer or other coverage is lost. So, for example, if I lose my employer-sponsored insurance coverage and am not eligible for Medicaid, which is the insurance for people who are at or near poverty level, I understand that this bill will allow me to re-enroll in Medicare Part B so that my anti-rejection medications will still be covered. I learned some really interesting things while researching this topic that I want to share. Medicare began covering dialysis in 1972, and it was pretty actively used as treatment in the 60s. So, they were a little bit behind the times on getting coverage for dialysis. They didn't begin covering kidney transplants until 1978. And again, transplants were becoming very common in the 60s. And then the coverage of the anti-rejection medications didn't start until 1986. And at that point, it was only covered for 1 year. It was in 1993 that they started phasing in the coverage for the current policy where the 3 years are covered. And in case you're wondering, if you're familiar with Medicare and you know that there's Medicare Part B and Medicare Part D, if you're wondering why they're covered under Part B, the first reason is that when this coverage was first established in 1986 for the medications, Part D didn't exist at that time. But also because studies by both CMS, which is the Center for Medicare and Medicaid Services, and studies by the National Institutes of Health, or the NIH, show that beneficiaries have less out-of-pocket costs under Part B than they would if immunosuppressants were covered under Part D. So I just found that quite interesting. And then could you go to the next slide, and we'll talk about the other piece of legislation. The legislation that is near and dear to my heart is the Living Donor Protection Act, which is introduced both in the House and Senate on February 14th of 2019. Did you get that? It's near and dear to my heart, and it was introduced on Valentine's Day. Yeah, clever. As I stated earlier, when my sister-in-law donated on behalf of my brother, she was told by her employer that she would need to return in 2 weeks or she would lose her job. Fortunately, she was physically able to return, but some people can take up to 6 weeks to recover from kidney donation. Living donors are exceptionally healthy people, but they're still having a major surgery. They will have restrictions on activity during their recovery period, such as lifting restrictions. I believe my sister-in-law also said she wasn't allowed to vacuum or dust during her recovery, but that may have been a way of getting their teenage kids to contribute more to upkeep of the house. In cases like hers, they can be quite challenging because both the donor and the recipient, my brother, her husband, were recovering in the same household. Fortunately, she was able to have her sister stay with them for several weeks. And in my case, I had several people who wanted to be donors, but they dropped out when they were told that they could potentially be off work for 6 weeks if they had very physical jobs. One of these, who was going to be a donor, asked his employer if they could make accommodations for him during this recovery period, since he wasn't sure what he would be able to lift or push, and he does have a physical job, and his employer wasn't going to be able to make those accommodations for him. So again, he could potentially be looking at 6 weeks, not only of lost income, but currently potentially losing his job. I've heard other horror stories as well. One of the other National Kidney Foundation Kidney Advocacy Committee members from Wisconsin received her first kidney transplant from her brother, and as I understand it, he was fired after he donated. These heroes should be celebrated, not punished. Can you go to the next slide, please? So the current status of the Living Donor Protection Act, the first bill that I talked about, the immunosuppressive bill, only the original sponsors are currently signed on as co-sponsors or as sponsors of the bill. There aren't any other people signed on it, but that's because it's so new. With the Living Donor Protection Act, again, this was introduced in February of 2019, and currently we have 3 people in the House of Representatives who have co-sponsored the bill and none of our senators. So in total, there are 80 co-sponsors of the House bill. In both chambers, a bill is more likely to get a hearing or a vote if the number of co-sponsors is half of the total members plus 1. So the magic number in the House to get a hearing or a vote is typically 218. As I said, we currently have 80. So there's a lot of work to be done to get this bill some attention. And as I mentioned, that's not a mistake on the Senate side. Neither Senator Baldwin nor Senator Johnson have co-sponsored the Living Donor Protection Act. The Senate in total currently has 18 co-sponsors, and the magic number is 51 to get a hearing or a vote. That doesn't guarantee a hearing or a vote, but it makes it more likely. But we're still doing better than we did when the bill was introduced in the previous Congress, so we're having a little bit more success. If there is no action on this bill by the end of this year, 2020, then the bill dies in committee. And what needs to happen is it needs to be reintroduced into the next Congress. Unfortunately, Living Donor Protection Act is not a bill that garners a lot of Republican support because they worry about the costs that could affect the employers. My argument against that is that most employers will have few people interested in living donation and even fewer that will actually qualify. That being said, I have some interesting statistics about the UW Health program in Madison because they had a significant increase in the number of altruistic or non-directed kidney donors in 2019. A total of 28 people donated to strangers. The first altruistic donor at UW Health was in 2003, and from then until 2017, they had about 4 of that type of donor per year. That increased to 12 in 2018, and then to the amazing 28 in 2019. And on a personal note, that number for 2018 would have been 13 if the woman who had donated on my behalf had done what she intended to do, which was donate altruistically. I would love for everyone that's advocating for the immunosuppressive bill that people are very excited about right now to also ask for support of this bill, the Living Donor Protection Act. So can you go to the final slide? These are a couple of action ideas that I thought of that you might want to choose to begin or increase your advocacy efforts in 2020. Let's take a couple of minutes to review some of these ideas on the slide, and let's all make the decision to take action in 2020 as a transplant advocate. While you're reviewing some of these options for actions to take, I'm happy to begin taking questions. And I want to say that if anyone else has experience with advocacy, please share your stories. Any other ideas for taking action in 2020 are welcome and encouraged. And that's it.
Sarah, everyone's just kind of reading through the list. Here in the room, we did hand out a couple of the key sheets that you talked about, but does anyone, at least here in the room, have experience with advocacy, or Jim?
One at the local level, actually, quite regularly, I have a booth at our county fair. And again, this year being an election year, a lot of times politicians choose to come to the county fair, and a lot of times it's a little more low key and a better opportunity to talk to them about issues, and it's a good place to have a booth on organ donation.
Anyone else here in the room either visited or had a relationship or experience, even if it wasn't as in the transplant area? Joan?
Having worked with Aurora Healthcare, we had governmental affairs staff. So when I had concerns that would impact, transplant recipient candidates waiting, I would go to our government affairs individuals who have relationships in Madison, and I know Frederick has the same type of people in UW, but if you can give them the information as healthcare professionals to take back, because they're not experts, they can at least make connections with the representatives in Madison.
Sarah, can you talk a little bit about things locally in terms of finding a local office and maybe just setting up a visit or things on a local level?
Is that to me, Cindy?
Yeah.
Oh, sure. So the easiest way to find the contact information for your legislators is to go to house.gov, just house.gov, or senate.gov, and there's a pretty obvious link that will say find your legislators. When you click on that link, most of the time you just have to enter your zip code. Sometimes you'll have to enter the zip +4 because the district is divided in such a way that it'll split up a particular zip code. But that's usually all the information that you need to enter, and it will link you directly to your House representative and to both senators' offices. The senators tend to have, between 4 and 7 offices spread throughout the state. I will guarantee both of them have offices in Milwaukee. So you'll get the phone number and address and all of that information there. And then they have their Washington offices listed as well. And then House representatives, because their districts are a little bit smaller and don't encompass the entire state, tend to have fewer offices. I think Ron Kind has 3. I don't know how many Gwen Moore has in Milwaukee or Mark Pocan has in Madison. But again, those various office locations are shown so that you can find the one that's closest to you and the phone numbers. When you call, the initial call, just like any office, it tends to be kind of a receptionist type person. And you can just give your information to them if all you're saying is, I want Senator Johnson to support Senate Bill 511, which is related to the Living Donor Protection Act. That's all you have to do, and then they'll ask for your name and address because they want to make sure that you are living in Wisconsin. And if you call a representative's office, same thing, they'll want your name and address because they want to make sure you're living in that district. And that can be, as easy as it gets. When you want to make a little bit more meaningful contact, you'll want to talk to staffers, and it can be anybody from the health liaison to the person that's more in charge of all policy development. And they have those staffers in both the local office and in the federal office. And that's usually how you get in touch with them. And then again, because most of these guys maintain their own social media accounts, Twitter and Instagram, for those of you that are savvy with it, I'm not as savvy as I would like to be, though that's a great way to keep them informed about what you're interested in and what you want them to support.
Are there other questions? Any online at this point?
No.
Any other questions or just comments in general? So we do have some recipients in the room, Sarah, that are not kidney recipients, but do have a connection to donation and transplant. So you don't have to be a kidney recipient to be an advocate for these pieces of legislation, correct?
Right. We have people who are family members of deceased donors. We have, living donors. Anybody with a connection. You can be a healthcare professional who's involved in kidney health or liver health and become an advocate on that matter. And I couldn't hear, I think it was Joan, I couldn't hear her very clearly, but she was saying something about the government advocates at a health care organization.
Yes.
Yeah, that's a great idea, and it's ironic because I asked my boss, I work with a bunch of nurses, and we do a lot of review of transplant requests. So because I work for an insurance company, if one of our members needs to have a transplant, we review all that information and make sure that all of their pre-visits, their pre-transplant visits are covered, and all of that kind of stuff. And one of them asked me about this information, and I said to my boss, how can we get this out to the company? So we're actually going to share this with all of the staff in our insurance company and ask them on their own time to contact their legislators if they want to get support of this bill.
And I think the other thing that is just kind of coming top of mind for me, Sarah, and I don't know if you've seen anything, but there seems to be more discussion about the census and how we really just need to educate people about definitely filling out the census, because as you talked about, that's how representation in government. I mean, do you have any opinions or thoughts? Because that's something, no matter what type of person we are or how we're connected to donation, to me it seems like something else we could perhaps just be getting more educated about.
Sure, and that goes back to what I was talking about when in 2003, Wisconsin actually lost a congressional district because of our declining population. So that's one of the reasons why the census is so very important. That people go door to door to try to get your information. They also send out mailers, all of that. It's just, it is so critical for people to return that information so that we have an accurate count of what our population is. I don't think it's likely we're going to get that 9th district back, but you never know. And it's a critical piece. And thanks for bringing that up, Cindy. That's something I don't usually talk about.
The other thing I just kind of want to talk about is it's not just public policy or being an advocate isn't just contacting legislators. A big issue here in Wisconsin is the fact that some of the transplant centers are telling our organization that people are just saying no to becoming a living donor because they can't get time off because they work for a small to medium-sized business. And therefore, as Sarah said, they're not covered by the federal law for that, if you will, employers must give time off, etc. And living donation. And to me, gathering stories about the impact of the positive impact that transplant has on all lives, but also I think gathering your stories about how either employers or community members came together to support you, because we're starting to get a lot of calls from employers also, small employers that are saying, how can I help this person? They want to be a living donor, but what other ways can we support them? And so do you allow people to chip in other employees their vacation time so somebody could take time off? So we're looking also for some stories because we want to put a toolkit together for small to medium-sized businesses. So advocacy isn't just governmental advocacy, well. So any other questions here in the room or online or comments about Sarah's presentation? I think she did a great job. She was a little worried about Schoolhouse Rock, and I don't know how you guys feel about that, but I think we need to be reminded about, you know, just some of those nuances about that. Sarah, we want to thank you for joining us tonight. It makes me feel good that we have someone like you as an advocate to hopefully inspire other people to do things. So, Sarah, any final comments before we let you sign off?
Well, it's certainly my pleasure to join. You know how strongly I feel about this, and if it hadn't been for the fluke of me doing this type of work related to the Affordable Care Act, I wouldn't have had a clue where to start on this. So I feel like we're put into the place we need to be, and I happen to be in the right place back in 2008 and learned a lot about this, and I'm much more passionate about the legislation that I work for now than I was about my work. I mean, that was important, but this is life-saving. And I just as
you learned a new fashion tip about flat shoes and washing.
Absolutely. Yeah. No, I never kind of got the whole no pantyhose thing until that.
I noticed several men in the room are writing that down as a note on the PowerPoint. Yeah. So, Sarah, thank you so much for joining us tonight. I know everyone here in the room, we have a packed house here in Milwaukee, and we're most appreciative. And then we will have a recording of this, and we do have the entire PowerPoint. So I know some of you were trying to take notes. So if you do want that, we'll post that on our website. But we're also happy to print it out and mail it to you if you don't have that. So Sarah, we're going to let you sign off. And
could I say well done?
Oh, yeah, well done, Sarah.
Thank you very much.
And so Sarah, thank you very much. I think John will probably end the session, and we appreciate it. I'm going to make a few comments and give a little homework to the people in the room, but thank you.
Okay, thank you.
And for everyone that was online and joining us tonight or via Facebook, I hope you'll join us next month for our program. And I believe the date is February. I think so. I have it in here in my purse. So, so some of you did get the letter with the dates coming up. So I do want to just remind you about that. It's February 18th. So we couldn't get it on to the 14th. Sorry, Paul. We wanted to. But next month, our speaker will be Lisa Hare, who is a performance excellence, I don't want to say coach, but she's actually at Frederick Health in the Medical College of Wisconsin. Lisa has presented to several of our professional programs and will be coming here because it's Heart Month, and addressing the kind of the physiology